Larry, I work with Healthy Public Policy for Toronto Public Health. So I'm working on a mental health report, and we really want to look at the overall well-being of Toronto residents.
Yeah.
There's a lot of work right now, there's a lot of focus on mental health and on recovery and reducing stigma, which is really important, but we really want to look at positive mental health and what promotes positive mental health, what are determinants. Yeah. Social inclusion is a very big area that I'm exploring, and I thought that this would be a good place to talk about and look at the issues and what policies we could think about that would promote social inclusion. So I was very interested in Sherry's talk today, policy, yeah. And I think I'm going to try to incorporate these ideas in the report. And another area that I'm exploring specifically is intergenerational programming as a method of promoting well-being for younger people and reducing isolation of seniors. So I'm exploring that idea and talking to various people here who may have familiar with other programs or interested in building something with an intergenerational focus. So it's a good way to reduce isolation for seniors, build community, and so I think a lot of focus is, I don't think there's a lot of emphasis on how our overall mental health affects our physical health and our connection to our community.
Yeah.
I think our mental health affects it's a determinant of health, it's also a consequence of health. So if we're not feeling well about ourselves or where we are in our life, we're not accessing resources that could help us change that situation. And at the same time, if we don't have the resources to access supports to improve our mental health, again, we're caught up in that cycle. So I think it's critical to address positive mental health and I think building a sense of community, a sense of belonging goes a long way to improving individual and community health. I'm not sure how to come at that question. Let me think on that. I think we are looking at our first step is look at what can our municipal government do, what kind of policies do we have in place that are facilitating overall well-being, and some of the policies that Sherry talked about, like we are pushing for more green space, walkability. One area that I think as a municipal government we can do more in is creating more public spaces that are accessible and promote social connection. And more so in the suburban areas. We have a lot more going on in the downtown core than we do in the suburbs. At least that's my downtown center perspective. I could be really wrong, but I think we need to do more to promote community and people making social connections in the suburbs.
Yeah. And
so I think policy could, I'm not exactly sure.
Yeah.
The mixed use notion is very important. I think we're looking at inclusionary zoning in Toronto to try to build more mixed use spaces. I'm certainly aware of that, and we've been doing our internal work on improving mental health literacy. So a colleague in the mental health program developed a report on mental health promotion and just exploring our own understanding of mental health and mental illness, and how even within our organization we have such variance in terms of our understanding, and a lot of that has to do with our own perceptions and attitudes around mental illness. So we're trying to develop a common language within our own organization around mental health.
In a more friendly language.
In a friendly language, and are doing our own bit to reduce stigma associated with mental illness,